Welcome to our video about ringworm on elbow. If you have a ringworm on your elbow, you are not alone. There are millions of people who suffer from this fungus, and it can last from 2 to 4 weeks. To get rid of it, you need to use the correct antifungal medication for the correct amount of time. You can ask the pharmacist for advice. Watch to discover what type of treatment will help you get rid of the ringworm. The type of medicine that you should use for treating this condition depends on the severity of your symptoms. Tinea capitis. A ringworm rash is one of the earliest symptoms of a fungus infection. The ring-shaped rash may also look like a bullseye or target. The edges of the rash may be slightly raised, which helps distinguish the two conditions. Both conditions are treatable, but if you scratch them too much, you may risk further skin infections. Symptoms of ringworm may resemble those of eczema or atopic dermatitis. Tinea capitis is a fungal infection of the skin that begins with the word tinea and is followed by a word that refers to the location of the infection. Tinea capitis, for example, is an infection of the scalp. Acute cases can lead to scaling, itching, and hair loss. Tinea capitis is best treated by a medical professional. Treatment for tinea capitis is not effective if it is left untreated. A doctor may prescribe a topical antifungal cream to treat it. However, this is not always sufficient. In some cases, the condition will recur, requiring systemic therapy to resolve the problem. Fortunately, the best-known systemic medication is griseofulvin. It is a powerful antifungal drug that needs to be taken twice a day for 6 to 12 weeks. However, the drug is costly and unpleasant to swallow. Most forms of ringworm can be treated with over-the-counter or prescription antifungal medications. Some people require prescription-strength oral antifungal medications to clear up their infections. You should also change your hair tools regularly to prevent reinfection. Keeping them clean is also helpful because ringworm thrives in moist conditions, so you must always dry them thoroughly after bathing. In addition, be sure to wear loose-fitting clothing. Differentiating tinea capitis and ringworm on the elbow is not as difficult as you might think. Clinical characteristics and symptoms help you distinguish between the two conditions. The rash is non-scaly, but there may be some associated crusts or vesicles. Typically, tinea capitis are non-scaly with a thin border. The lesions may be erythematous, non-scaly, and dorsal. The rash may also appear like a Christmas tree pattern. Tinea pedis. If you're experiencing symptoms like athlete's foot, ringworm on elbow, or both, you should see a doctor. This condition can be spread from person to person by touching contaminated areas. It is also known as tinea pedis. The symptoms of these infections are usually mild and temporary. During severe cases, you may notice that your elbow is very painful. A medical professional can treat both conditions, though treatment for one may not be necessary if the other is present. Treatment for ringworm is different than that for tinea pedis. While ringworm on the elbow can spread to other areas of the body, it is generally a short-term problem and usually goes away on its own within 4 weeks. However, scratching is always a bad idea because it can lead to more infections. In addition, there are several other rashes that resemble ringworm but require different treatments. In addition to being uncomfortable and painful, ringworm can be incredibly embarrassing. You may not even realize it's an outbreak of ringworm, but it's a very real and frightening problem. In the meantime, you're not alone. Several different types of fungi can affect your body. In addition to an athlete's foot, a ringworm on the elbow can affect the elbow as well. It's a very common infection in children, but it can be spread through contact with infected people or through contaminated objects. Most cases of ringworm on the skin can be treated with a topical antifungal cream. You can purchase antifungal creams over the counter, but they take a few weeks to work. If you don't see any improvement after applying the cream, you may need to visit a doctor for an antifungal tablet. Your doctor may also prescribe an antifungal cream. A dermatologist can prescribe antifungal medication for ringworm on the elbow. Tinea corporis. The differential diagnosis between psoriasis and tinea corporis is based on clinical presentation. Symptoms of tinea include erythema, white scaling, peripheral blood vessels, small follicular papules, and brown spots surrounded by white-yellow rings. In refractory cases, a skin biopsy is necessary to determine the causative organism. A skin biopsy is often necessary to rule out Miyake granuloma. If a rash persists, it may be a symptom of a secondary bacterial infection. Treatment for ringworm and Tinea corporis depends on whether they are acute or chronic. In acute cases, treatment may involve applying topical corticosteroids to the infected area. Continuing topical ointments should be used for 1 to 2 weeks after the rash has cleared up. A recurrence of the infection is not uncommon. The symptoms of ringworm and Tinea corporis on the elbow differ significantly from those of eczema. Tinea corporis spawns a circular rash on the elbow, arms, and legs, and is usually associated with a scaly area. This rash may eventually progress to a raised, ring-shaped rash. However, the ringworm rash is not circular. It may be irregular in shape or even separate into several rings. The outer edges may be clear or covered with red flaky patches. The rash may also resemble a bullseye, and the skin may become thick and scaly. The symptoms of ringworm on the elbow are similar, but they differ in appearance. The infection is often characterized by a red rash that spreads outward from the center. The borders of the rash may be papular or pustular. Often, ringworm on the elbow is spread through autoinoculation when the infected area is scratched. Young adults are at greater risk for this infection, so proper prevention is crucial. Poor hygiene and warm environments are the main causes of Tinea corporis in young adults. Contact sports and diseases that cause defects in the skin barrier can also facilitate tinea. Another risk factor is sharing clothing and towels. This is a common practice among contact sports athletes. A common source of infection is touching contaminated objects. Tinea corporis and ringworm on the elbow can be caused by different types of fungi, and it is possible to acquire these fungi from various sources. Most commonly, the fungi that cause ringworm on the elbow are Trichophyton rubrum or Microsporum canis. These are the two most common types of ringworm in the human body. They are also the hardest to treat. Tinea cruris, Tinea pedis, and ringworm on the elbow are very similar skin fungi. Both can cause scaly, red patches. Tinea pedis causes small blisters on the feet, while ringworm on the elbow looks like a scaly rash on the groin area. In most cases, both infections can be treated with the same home remedy, but ringworm is more difficult to treat when it has spread throughout the body. In the case of ringworm, it can be difficult to distinguish the fungus from dandruff. The two types of fungi have different symptoms and can occur in the same body part. Tinea versicolor is typically more visible on darker skinned people. Treatment usually involves shampoos and dandruff soaps. The shampoo should be applied overnight and washed off the next morning. Some people report mild itching while sweating. If you suspect that you have a tinea infection, you need to consult a doctor immediately. You can get it from an infected person or animal. Sometimes the infection is transmitted through soil. Autoinoculation occurs when the infected area is scratched. Young people are most vulnerable to tinea infections. Warm conditions, contact sports, and diseases that compromise the skin barrier can facilitate a tinea infection. Other risk factors include sharing towels, clothing, and toiletries. The symptoms of ringworm on the elbow are similar to those of ringworm on the scalp. Tinea cruris can be hard to detect, but your doctor will be able to make a positive diagnosis and prescribe a treatment plan. The fungus is caused by a fungus called T. niger. It infects the skin of humans and animals and can be spread through contaminated objects. Clinical presentation is key when determining the correct diagnosis. A skin lesion may be easily distinguished from psoriasis because the two conditions share some morphological characteristics. Often, tinea lesions are erythematous and non-scaly, with thin, red borders. In addition, the lesions are usually associated with a rash or a Christmas tree distribution. Thanks for watching. Please like, comment, and subscribe.